Yeah, 0 to 140 is incredible.
Yeah. I can make a difference. Like,
Yeah.
this was my calling. I want to take care of the elderly. Patient care is like my priority, but long-term care is where my heart is. Business should not change from one day to the next because all of our focus should be taking care of our residents. We believe on 3 pillars that we really focus our mission and vision on. Quality of care, of course, customer service, staff appreciation. If you focus on those 3 things, the rest comes. 5 years from now, I want us to keep giving back to Texas. I want us to be Texas people. I want us to have great care. I want us to win more. I want the best. The fun thing about Avere is our story is being written. Your company is the best because of the people on the ground, right?
100%.
That believe in what you do, believe in what you sell. How do we keep people wanting to do this every day? I can't do it all, and I have to have people and trust people to do their job. I think that's what scares me more than anything. I'm sure it does y'all too, but just building like our next generation of who's going to take care of us when we get old.
All right, welcome to Our Purpose Podcast, the podcast where stories from long-term care and skilled nursing come to life. I am your host, Kip Kruger, a voice shaped by industry experience and a belief that everyone has a story and their purpose is worth telling. Got CEO, Principal Health, James Dieter, COO, Chris Light. Welcome, guys.
Hey, thanks.
It's a good day at THCA.
That's right.
Yes, it is.
We are here at THCA.
Awesome. Well, I will go ahead and introduce our guest, Ashlea Ondrusek. I'm going to read this because it's that good. Ashlea is a Texas-born healthcare powerhouse whose career is a masterclass in climbing from volunteer routes to executive suites, all while keeping patient dignity at the core. So, I love that.
That's nice.
Let me put this away. Yeah, I would write something that nice about me. But so a lot's going on in your world. I kind of was thinking about what question I would start to ask, and I ended up with like, when is your next day off?
There's no such thing.
I can't imagine right now there is.
There's not a such thing.
So I think you guys are at 92 facilities right now with Avere Health Group, where
That's
you're
correct.
the executive vice president of Texas operations.
Yes.
That's like
yes.
a mouthful.
It is a mouthful.
92 headed toward, sounded like maybe 140 or something like that.
Yes.
Yeah.
Mm-hmm.
So what's it like right now?
It's good. We're growing and we're putting back into Texas, and there's a lot of small companies forming into us, focusing on our culture and just giving to our residents and our staff. That's our number one right now.
Perfect. And so you guys are you cover the entire state, right?
We do.
But Avere is also pretty large presence in Florida.
Correct. Aspire is our parent company. So we have Florida, Pennsylvania, New Jersey.
Awesome.
Mm-hmm.
Okay. And then, so how did your role, because you were previously with Trinity.
Yes.
And so you were running similar position just with 20-something facilities?
25. Yeah.
And so how did that all, I would imagine there's a lengthy interview process. You're kind of brought into the fold at some point.
Yeah. So we refer Avere as phases. So we have like 1.0, 2.0, 3.0. But when Avere first formed in February 28th at like 5:30 p.m., if we want to get real exact.
Wow. Of this year.
Of this year.
Wow.
So 6 months ago. When Trinity, we were looking at selling, and Ryan Harrington, my previous CEO, was like, what are you going to do next? And are you going to do your own thing? And the guys came down, our owners, and we met. I was like the first person they met in Texas, and they interviewed multiple people, and they said, do you want to go on this crazy journey? Now, did I think it was this crazy at the time? Maybe not, but it's been very rewarding. They're a great group of people. They care, and I like what they're doing for Texas. So
Very cool.
Yeah, 0 to 140 is incredible. Wow.
Yes.
In 6-7 short months.
Exactly. Our first 1.0, like I said, was 5 sellers, or 5 different sellers that had buildings. 2.0 was 7.
Wow.
And 3.0, I can't really say, but it's multiple. So yeah, it's been interesting.
It's more than one.
Yeah, it's more than one, for sure. Yes.
Talk about your background, like where you came from. I know where you came from. We have a relationship that we didn't even really know about until recently. But tell me about your past and Eat 'em Up Cats.
Eat 'em Up Cats. Well, I'm from Yoakum, Texas, small country town, 1 stoplight. So yeah, I went to school in San Marcos, great campus. I was an ambassador orientation leader, I worked for the Parents Association and the Alumni Association. You name it, I did it. I was even on some of the brochures, by the way.
That's all
Like
nice.
when they formed Jumping into the River at graduation, I was the one that jumped in and they were like, okay, dry your hair. Like, and we took pictures and videos. It's pretty cool.
How cool.
But yeah, no, I actually went to Texas State or Southwest because I was a volunteer, was a PAL, and we did elementary schools and we did nursing homes. So I went into multiple and thought so I went into healthcare administration. I did my residency actually at St. David South Austin Hospital. And I got the opportunity to stay there. And I decided, no, I worked for Seton for a little bit, actually. But ultimately, I worked for Regency, which is out of my hometown area, Victoria. And long-term care is just kind of where I've been. And I left long-term care for 3 years to be a CEO of a hospital. So I did that. Again, patient care is like my priority, but long-term care is where my heart is. So I'm glad to be back home.
What did you learn? I read about that. You were at an LTAC hospital.
I was.
And those were different times for an LTAC hospital than they are
different
today.
times. Yeah.
You're probably treating some of the patients that you previously treated in
I
LTAC,
did.
I would imagine. Yeah.
Yes.
So can you kind of think of one or two things that you, being the CEO of an LTAC, kind of helped prepare you in the role that you're in now?
I think everything depends on developing your community, right? Like serving the people that we serve. It was a lot. It was a lot of interesting times at the LTAC. It was a great experience. I think ultimately the industry's small, and that's what I've learned is we all will work together in some form or fashion. Kind of like Kip and I learning that we go back to those Eat 'em Up Cats days.
Yeah, she was my orientation leader. Like, who would have thought?
Kip often says that his orientation leader put him on a path for the rest of his life.
That's totally,
It's on a resume.
totally.
Two former Texas State alums.
I mean,
that's pretty cool.
yeah,
On the same
it is cool.
podcast, who would have thought?
And how about those Bobcat football right
Dude,
now?
they're incredible.
The football's coming
doing
strong
well.
this
Yeah.
year.
They weren't so great when we first were there, and now they're in the Southwest Conference, and now they're doing exceptionally well now.
They're doing well.
Got the gold helmets. They're doing good.
Me and Travis had lots of banter last night at dinner about the Bobcats.
Yeah.
I think they're better than Tech. We had a huge argument about it.
I hope so too.
Ooh.
Tech is spending a lot of money.
That's what he said.
Yeah.
He said they're coming up to be number one. So
They have I think on NIL money, they might be number one.
I think they might be.
Yeah. It's
That oil money, baby.
It's that guy, what is his name? Cody something. He's like a Texas billionaire.
Yeah. He's just, I want to win and I'll pay for it. It's the Miami model.
Yeah, right?
Yeah. It's the Miami model.
hey, but you know what? Give to Texas. As long as we have Texas winners.
We
I'm all
got 3
about it.
teams in the top 25 right now, which
Yeah.
is good. So,
Aggies are looking real good right now. Gotta say.
and they are looking
Gotta
good.
say.
Gig 'em.
Gig 'em.
Mhm.
Maybe we can
UCF,
get
guys,
Bobcats
I don't know if
next
you
year.
heard
We'll
of
have
UCF.
4 of them.
We could.
Be awesome.
You know, I want to touch on something you just said there. So, I can take a say from my clinical expertise. So I started out in acute care hospitals.
You did.
So as a nurse practitioner doing rounds there, and we went from acute care to got into long-term care after that. We did spend a lot of time in LTACs, primarily LTACs, and then we'd move into a little bit of skilled nursing. And we used to keep people, we had folks I would see for a year in an acute care hospital. And, the LTACs, it was like you'd see them for 2, 3, 4 years, some of them. And then it moved down. And those patients no longer are in the acute care. Like they're 3 days, they're gone.
Mhm.
And then they move them into LTACs for a moment and then they move them to skilled. I really don't know if even people in our industry truly understand what has happened and how the acuity of care has moved from hospitals to LTAC to skilled nursing. We have skilled nursing facilities with critical care beds now.
Absolutely.
The level of care is tremendous, and everyone's supposed to be. There's obviously budgetary restrictions of how you can treat somebody in those type scenarios, but there's also just the level of how many people you can hire. We have a shortage in nursing. It's really, really challenging. So, I'd love to hear not only you touch on, hey, we've gone from 0 to 140 buildings, but we're seeing a higher acuity of care, and what is that like?
So, to your point, yes, especially when I was running the LTAC. The LTAC is where people went for vents. It's where they went for in-house dialysis. Now we have multiple buildings that have in-house dialysis chairs. And, we're continuing to build more in the markets that make sense, which is good because then the hospital knows they can trust us and the patient's coming and they're being able to be serviced in their home instead of having to go out or take a van trip to go to dialysis, right? We do have vent units in some of our buildings, which is, again, a little bit different.
Wow.
So, a lot of the conversations that my chief nursing officer and I have are, how do we train our staff? How do we get our capabilities up to be able to take more and keep people at home for as long as possible? because they don't want to go to the hospital, as y'all know. So as much as we can service within. So one nice thing, there's many nice things about our parent company, but we have a nurse practitioner group that is forming in Texas. So we're actually helping our doctors with more NP coverage.
That's great.
To help prevent RTAs. So it's one of our big focuses.
Good. Is there any specific focus that they have? And I know the NPs are going to come to the facility. Are they targeting like any specific diagnosis, people with wounds? Like what are they blanketing everybody?
They're blanketing everybody.
Good.
We focused it on our buildings that we've seen, that we've acquired. Obviously not all these numbers are our numbers, but they're our else. Yeah. What's the reason they're being sent out? How can we keep them in? How do we up our skill set for our nurses? To your point, nursing shortage is such a big thing. So recruitment is a big part of our focus as well. And, everybody, we want everybody to come work for Avere.
Yeah. I'll give you an opportunity. So I have heard many people, I guess just in my position, former administrator, reach out and they're like, hey, what do you know about Avere? Hey, what do you know about Avere? Tell administrators, tell DONs, like if they are to be acquired through Avere and become Avere, what can they expect?
That's a great question. I think the main thing I tell, especially when we have like a announcement call or transition call, is business should not change from one day to the next because all of our focus should be taking care of our residents. So that's our focus is you're not going to have a vendor change today, right? You're not going to have these things change today. Come in, take care of your patients, do your best. And that's what we expect. And I'm sure your previous people expected that too.
Yeah.
So as far as like administrators and recruitment, we believe on 3 pillars that we really focus our mission and vision on. Quality of care, of course, customer service, staff appreciation. If you focus on those 3 things, the rest comes, right? Your census grows, your reputation gets better. Now, we are a for-profit company.
Sure.
My COO would tell you, we're unapologetically for profit, right? We all have to make money, but we make that money so we can put back into the building and do remodels and do nice things for our staff and give back. We just recently donated some money to Kerrville. We have a facility there. So we believe in giving back to the community. That's our biggest goal.
That's awesome. I think that helps a lot. It's specifically like administrators and DONs. That's a super uncertain like feeling for them. Like, hey, someone else is coming in. What are they going to do? Are they going to change a lot of stuff? Like, do I need to start looking for another job? I think
we have kept everyone.
Good for you.
And we need talented people. Like we're growing. We need talent. And who better to run our buildings than the people that are experts in their buildings?
Yeah,
so
for sure.
We have kept everyone and we continue to do that.
That's exceptional. That's good. I think that gives everyone just a piece that, like if it win, right? When Avere acquires you. You'll be in good shape. I mean, we have 0, now you have 140. That's a lot of people. So it's good to hear.
Mm-hmm. Well, and we have 9 regions today. We'll be expanding that for a 140. But I have an exceptional regional staff, and a lot of them I've inherited in some of our growth, and some we've been able to bring in and promote. Where we love promoting people. I know a lot of administrators want to know, can I find a promotion? Can I grow? And yes, if we have the room to grow, we're going to try to promote from within if we can.
That's awesome.
Yeah.
So one of the things I think that's been challenging for me, I would say, like over the course of my career, is I continue to get further away from the front line, so to speak. So I try to put myself there and manufacture it as much as you can, right? But you're building these field teams, and so you've just done it on like hyper speed. You were already away, but now like on hyper speed. So I guess, what do you focus on? I guess, what has been the biggest surprise for you in the role? And then what are you focusing on to kind of like, because it's very important that people in operations understand what's happening, but it gets exponentially harder.
I mean, I think if you want to go with the surprise first, I mean, who thought we would grow this quickly? So, I mean, I think the growth has been the surprise. I mean, we knew we were going to buy, but maybe not at the speed.
Sure.
But everything happens for a reason. I truly believe that. I think the biggest thing has been organization. I'm very, I hate to use the word OCD, but my regionals would probably tell you that. I believe that there's a policy, there's a procedure, and there's a process, and we're going to help build the map for our people to be successful. So that's really what our focus has been. Building a great regional team, because to your point, I'm used to being small.
Yeah.
This has been a stretch. I'm used to being in my buildings and hugging my residents. And, with us being this large, that hasn't happened as quickly as I would like. But That's why I have great extending team that can come in and be that face of Avere and create the culture we're trying to get.
Very cool.
Yeah.
I'm going to go back to real quick. You mentioned a nurse practitioner group.
Mm-hmm.
How does that dynamic work? So it's like they're supporting the medical director of the building or the rounding provider group of the building or all of the above?
All of the above.
Okay.
Yeah. So, because, we have a lot of buildings in rural Texas, small town, and that physician may be rounding at 18 places, right? And they can't get there. So we try to find a really good middle ground to where they feel good. And we marry that nurse practitioner. And it may be someone they know that we hire. So it's not like necessarily people that are from out of state. They're Texas people. Mm-hmm. But ultimately, it's just to provide the best care for our residents.
Yeah. Mm-hmm. I was speaking to a large rounding provider group, and I was like, what's the secret? They have these amazing numbers with RTAs, and they're like, it's like old fashioned medicine. Like, you have to be there.
You have to.
And you have to see the people. And if you can do that, that's a big piece of it.
Well, and when I walk in and our residents are hugging our physicians and are crying with our physicians or whatever, I think that's like the biggest thing of long-term care. If we want to go back to the difference between acute and long-term care, acute, they're gone so quickly. You don't form a relationship. We become family members of these people, these residents. We're their trusted ones. We see them more than their loved ones. So, they get excited when I walk in. There's some of my buildings that I've had for years, and the resident council president will be like, where you been? Come give me a hug. And that connection is so important. Yeah. And that's what makes long-term care so unique, that connection.
Very cool.
How much telehealth is going on there? Are we using it? Is it not being used much?
No, we try not to. I mean, it's in some cases had to happen, but I think we all know everything's better in person.
Oh yeah, 100%.
Yeah,
good for y'all.
So that's our goal.
I like that.
Very cool.
Where do you want to see Avere in 5 years? I'm curious. A tremendous amount of growth. Obviously, there's more growth to come. I would imagine. But are you growing? Because you're even surprised about it. So from the ownership perspective, would you expect that they were surprised? Are they opportunistic and then they're just taking advantage of opportunities? Or is it a situation where they're really coming into Texas and saying, this is an interesting space, we're going to really double down here?
Well, I think if I can speak about their experience in Florida, I mean, they're the biggest, we are the biggest provider in Florida. They're used to being the largest, and they really believe in putting into like the Florida Healthcare Association, the same in Texas, which is why I'm a board member at THCA. I think that the opportunities have come, and it's like if we pass it, then when one of those opportunities going to come again, or are they going to go to another operator? And so I think the opportunity has just come, and they've kind of ran with it. And I do think I've made it look a little too easy. I think even some of the other operators are like, we don't know how you've done this, but I mean, it's truly because of our team. Like, we could not do this without our people on the ground, our administrators, our DONs, our regionals. It's been a great team. So 5 years from now, I mean, I want us to keep giving back to Texas. I want us to be Texas people. I want us to have great care. I want us to win more bronze, silver, gold awards for ACA. I mean, I want the best. I want us to be, I want people to be talking about what we're doing differently in the industry with partners like Principal.
Good. I love that. Thank you. How else, besides great partners like Principal, how else do you accomplish that? Like how is that, like, what specific initiatives are you taking to accomplish that? It's a big goal.
I mean, strategy, right? And it's also knowing the market, and if it's an in-house dialysis unit, like we've talked about, what opportunity can we open to be the best in that community, to make things easier to service, or what, service line can we bring in if we've opened quite a bit of outpatient therapy in facilities that needed it. So, just whatever that streamline is, we're just trying to strategize and provide the education for our team.
Okay. So from a standpoint, like young entrepreneurs or people that maybe even have a service line, is there an area that you feel like, now that you have so much scale, is lacking around the state of Texas, that you say, you know what, we really could use someone to come in and do this, and because it's falling on you?
I think that I kind of have two answers to your question.
Sure.
I think for me, I like having one vendor for whatever streamline to service all of our buildings. That has been hard in Texas. We end up having to have 4 vendors for X instead of having one. So I think if anything, it's the service line to cover our spread, right? And like having great resources and great outcomes from our vendors across the state line because Texas is so large. We joke about it, but my COO came in to visit for like one of his first times. He's like, "Are we going to see like 8 buildings today?" And I was like, "I'm going to say 3." Like, and we'll probably be driving like an hour or 2 between buildings.
Right.
And that's weird for them, right? Because Florida, Pennsylvania, New Jersey, you can go in different states up there pretty quickly. But yeah, I mean, I think that's been big, is just trying to create service lines that can actually cover our spread and it be a good outcome and it not be so strained on the vendor either. But, we really believe, like I said, in giving back to Texas. So
Love that.
Yeah.
Very nice. Yeah, I think the statistic is per square miles. Beds per square mile in Florida, it's 3 times what it is in Texas.
Oh yeah,
just because the land is, the mass is so big, so big. So yeah, I'm not surprised to hear that. We are at THCA.
Yes.
So you're on the board.
Yes.
We talked to Travis Clardy earlier, and so some of the initiatives that have been happening, he kind of talked about the PDPM. He talked about a little bit about the penalties, like not having double penalties and things like that, and really have boosted Texas skilled nursing kind of, I think he said 40 something, right? We were 40 something in revenue reimbursement. We're kind of in the mid 20s, low 30s.
Yeah.
So I guess on that line, PDPM is brand new.
Yes.
And so I guess kind of an open-ended question, but how are you all attacking it? It's obviously a major change in every building, really. But what's been your experience so far? And so are you bullish on it and things of that nature?
Well, I mean, I think with anything in healthcare, everything changes every day. Yeah. So we're always learning and educating. I mean, we've had a team of educators. We have a VP of reimbursement that's really led that model. And plus, because we've acquired so many different companies, there was education happening in that prior company. Yeah. And so we've just kind of merged it. There's a lot of AI. There's a lot of technology around the PDPM model and making sure your rates are captured. We've kind of explored that, and it's helped our MDS team with, Again, I think it's what's big about anything with capturing is we are giving a service. We just have to make sure we're documenting it. Yeah. If you didn't document it, it didn't happen. So a lot of it is the documentation. And again, just making sure we're taking care of our residents through that.
It's fun explaining that to somebody who doesn't work in healthcare. Like if you didn't write it on paper, it never happened.
It never happened. Yeah.
Interesting.
Look, talk to me about THCA. Talk to me about the board. How has been the conference? It seems to me as if there is a lot of people. We just left. We were there down there for the vendor fair for an hour. They're actually still going on right now. But what an incredible experience down there. It seems like this year, the turnout and the attendance is more than last year. And it seems to me that it just increases every single year. So as a director of the board, a board director, like how are y'all strategically getting that done?
Well, I mean, I think it helps that we're buying a lot of buildings. I'm just kidding. No. I mean, I think it's interesting, especially talking to my Florida counterpart, where they just have Florida healthcare, and we have 2 groups in Texas. I truly have been telling other operators, vendors, come to THCA, like join our voice, because our voice is stronger when we're together. It's not good when we're going separately and maybe we're saying different things, or maybe we are saying the same thing, but maybe to a different jingle, right? I think it's big that for Texas, we start unifying. So that's been a lot of my conversation. We've had some people join the THCA office that's our focus, is getting new membership, getting new people in. And we're excited about it. And you're right. There are a lot of people down there. It's good to see healthcare exciting, right? There's a lot going on right now.
I love hearing you say that. Would you believe it if I told you Travis did the exact same thing?
Did he not?
Promise.
Come on.
He's like unity. That's what he's like. He talked so much about unity. He's like, there's 2 separate sides. There's 2, 3, 4. He's like, but when we all come together, when we can all collectively, cohesively unite together, like we're gonna be better for it. And so that's what he was speaking about. It was really cool to hear.
Yeah, even going to the Capitol, I've gone with Travis up there. I mean, they want us to be unified, right? And I do think we all want the same things. We want the best for our population, for our elderly. We want to be able to give back. It's so good to see a change in our rates. I mean, Texas's rates are, if you look at other states, have been a weak point for a very long time. So it's good to see that, because we want to be able to put back into our buildings.
I've got an open-ended question too. So just as far as just the biggest challenge you've had? Well, I'd like to hear about the challenge of where you've come from and where you've been over the last, just this year. Just what are you dealing with? What would you say has been something that you're trying to get through?
I would say our biggest, besides our growth, I think our biggest challenge has been getting the buy-in because we've grown so fast and people understanding our culture and where we want Avere to go. Again, what I had to learn from being small to being large.
You still weren't that small. 25 is not like small.
It is comparatively to what I am now.
Yeah.
But there people knew me, they saw me, they were in the buildings. They that reach is pretty hard being about to be 140. And so I've had to really lean on my regionals, my divisionals to be that face, to build that culture. Whereas I felt like with Trinity, the culture definitely always started and ended with me. Now I really have to rely on my team to build that culture. So, and that buy-in.
Do you require, is it culture, part of the culture in Avere? So like one of the things that we always do internally, we're big on, first of all, like an all hands meeting that we do once a month. And then we do kind of talk, we call them quarterly coffee and conversations where it's like a town hall.
Yeah.
But we're big on one-on-one meetings, like with your direct reports. I'm just curious how you think about that and how your team thinks about that.
So we do a lot by teams, obviously, because it's as large and far as we are. I do a standing Friday call with my ops team. So, they talk to me very often. We do a monthly whole company ops call. Now, I think the fun thing about Avere is our story is being written.
Yeah,
so,
for sure.
We're figuring it out and we're getting bigger and, we may adapt and change to our size. But at the end of the day, we're still taking care of residents, regardless of our size. Like that's our goal is good patient care.
Yeah.
But we've had to adapt it just a little bit. But I think that's what's exciting about people joining Avere right now is we are forming our story. Everyone is talking about us. So, write the story with us because we are making history right now.
Yeah.
It's exciting.
You're a good saleswoman. That's part of it, right?
Yeah.
Just from a leadership standpoint is you have to effectively convince. This is like part of the job. A big part of your job is making people understand that they're going to be part of something bigger than themselves. They have an opportunity to be part of it, and their voice will be heard.
It's a cast a vision for those that can't do it themselves.
Yeah,
absolutely. Well, and again, like you and I both know, our companies, your company is the best because of the people on the ground, right?
100%.
That believe in what you do, believe in what you sell. But I think the big thing again, like it's like the transition calls. Nothing should change from today for tomorrow with Avere taking over because at the end of the day, we should all be doing it for the right reasons, which is our elderly population. So.
You say nothing changes, but I would imagine by now you've actually taken over some buildings in which you've improved quality of care. I'd love to hear just if you have, and you don't have to like call anyone out here, but like we've had buildings that were here and we've raised the quality.
So that's a great starter. So when Avere formed for 1.0, we had 2 special focus facilities and 6 special focus candidates. Today, we have graduated both special focus and we only have 1 candidate on the list out of 92 buildings.
That's incredible.
So that's pretty impressive.
That's super impressive.
And that's teamwork. That's the team. Again, that's, our clinical
culture,
teams.
Yeah.
So we're very proud of that. We've won some awards. We have a couple buildings that have won bronze awards for ACA. We have some winners at THCA. We're excited about where we're continuing to go. But it's been a fun journey so far. It feels longer than 6 months.
About to get off some awards here in a little bit, right?
Yeah, we have some winners here. A couple CNAs, nurses.
That's going to be really
nurse
cool.
Nurse of the year. Yeah.
Good for y'all.
You're going to have a lot of them.
No, this time not as many as maybe future sessions.
And so for those who don't know, special focus means?
Special focus candidate, there's a lot that can go around it, but it's usually from a history of bad surveys, survey points, IJs. It's a list that CMS puts out. They update every monthly. And I will say that when I took over Trinity operations, I had to learn what special focus was, and I got inherited 2 of those. And we just put everything into it. We hired some extra clinical people. We upped our staffing. We changed some of our policies, and it was pretty cool to see. And then that team, when we finally got off that list, we actually have a celebration coming up. Y'all should come. It's in Fort Worth
Let's go.
next week.
Do you need a DJ?
Oh my gosh, a DJ would be great. Yes. Yeah, we're having a food truck, but we're celebrating with our Fort Worth team next week.
You need a DJ.
On the 30th.
I know a guy.
I gotta check my schedule.
Oh my God,
He's
you should
available.
totally come.
If I don't have, when is it?
The 30th, next Wednesday, Tuesday.
Oh,
Yeah, in Fort Worth.
that's right where I live.
Exactly. No, you should totally come. But
Let's
yeah,
see,
like
Ivan.
seeing the teams celebrate
Yeah.
when they've
exciting.
graduated and like just doing stuff for them and all
So
that
you actually
hard work.
throw a celebration when they graduate.
Absolutely.
That's yeah,
Got
I
it.
love that.
Way
You know,
cool.
speaking of culture, I have to totally pivot and tell you something totally
Let's go.
Okay.
fun. We also do a Avere Day when we have 1.0, 2.0. So when we get buildings on, we send them swag. So all the employees get shirts, they get sunglasses, and we throw an Avere Day. And so we set a date.
It's like a yes
And
day.
each building creates a video submission,
Okay.
like of their building and celebrating their new name. So we're actually in the middle of like filing down on Avere Day 2.0. I may have to show y'all some of the videos. They're pretty creative, but first, second, and third for Avere 1.0. First place was Spring Branch in Houston here.
Okay.
They had a great video. Second place was Avere in Seguin. And third place was Terra Esti in El Paso.
Yeah.
So 2.0, we've gotten a ton of video submissions with their swag. So I'll have to show y'all some of the videos.
I'd love to see this.
And then our plan is to do a 3.0. And then our ultimate plan is for them to compete against each other
Yeah.
and kind of see who the best video is.
I love the social media.
I was gonna say it's prime for it.
I love it.
Yeah.
It's fantastic. Like that has taken over like exponentially just in the last couple years, I guess. But it's just I love seeing it. People really gravitate towards that, and I can't wait to see those videos.
Oh, I can't wait to show you. It's funny too, like, you know, we went and celebrated the winners. So the first place gets a food truck, second place gets a snow cone truck, and third place gets a pizza party. So I got to go to every celebration.
Nice.
And actually, so the first place, Spring Branch, had a dance team to where them fans at. We're just going to say that.
So what?
And so they did the dance for us on site. It was pretty great.
The residents or the staff?
Both.
Oh, nice.
But yeah, no, but the best part about it is seeing how excited they are about Avere and the change, but more like that teamwork, competition, like that funness that they
You
had
have to
doing
have
it.
You have to have
Yeah, like that's what I hear. Man, we had the best time making that video. And that's why we do it. It's culture, right?
It creates just an escape. And that whenever I was doing the TikToks, that was also something that was really fun, is that we were able to kind of escape a little bit and just like enjoy just creating the content with the residents. And we tried to do it as natural as possible.
Yeah.
And it was super fun because the residents were getting involved in it and they loved it. But it just kind of gives you this little escape from reality a little bit. And it makes work just a little bit more fun.
It does. And it creates some competition, which I think is always a good thing.
Always good.
Friendly competition.
Friendly competition's healthy.
All right. We got to nail down this DJ thing.
Yeah. I think it would be
I'm there.
epic for you.
It's already
to come.
nailed down as next Thursday, the 30th.
Yeah.
Yeah.
I gotta ask my boss
It's
if I
from,
can go.
it's
You're
from
free.
10
You're
to
clear.
2.
You're
From
clear.
10 to 2.
Yeah.
It's going to be a bunch of us there, and it'll be even more fun with the DJ.
That's so much fun. All right, I'm there.
Yeah.
Let's do it.
It's going to be
Boom,
fun.
I love
done.
it.
Book it.
Done.
We love
Love it.
celebrating our wins.
That's very exciting.
Yeah.
Gotta do it.
Just on that same thread of kind of buildings, we got the chance to talk to Travis a little bit about these double penalties. And so I've heard you're closer to this than me, and there's a lot of people who are way closer to me, but I've heard just some really horrific stories about like when it just doesn't make sense from an operator standpoint, like how do we get here? And so just from more, I'm kind of leaning back on kind of the THCA kind of Capitol Hill thread, like, do you still, Travis kind of mentioned like there's CMS, there's HHS, and then there's all these, different laws. I guess, where do you see that going, and how do you think THCA can have a bigger voice in that?
Well, again, we need more people to join THCA, so our voice is larger. We want it to be bigger. I think it's been interesting. It's been a hard couple years since COVID hit from a survey perspective, and I think it was a hard time in healthcare and in the world in general. And then most businesses shut down, but what didn't? Us, right? Yeah. Healthcare kept going, and we kept going through it. I would say that we saw quite a bit of double penalties. I haven't since it's passed, but I think the big thing I would tell people, kind of like this, is you should get in front of your health and human services people. You should be meeting with the heads of the state. Every time we buy buildings for Avere, I go and I meet with them and I say, we're buying these buildings. This is our intention. There's an issue, you know who to come to. And that open communication has been very big for us. So,
Smart.
I mean, I think a lot of people are like, oh, they're the enemy or we shouldn't. I actually would say that it's been better for us to communicate and tell them what we're doing and what we're building in the market. And then they see that we're putting, money and efforts and education into it. It's helped us in our markets tremendously.
Is that conversation happening at like the administration and the admin and the DON level as well too? Because I feel from my experience, like I went deficiency-free survey back to back.
That's
and
awesome.
Then right after that, then it was an IJ. And that was super disheartening. Like that just takes the wind out of all your sails. Do you see like, what I guess my question is like, how much conversation and how much communication are you giving back to the administrators and the DONs? Because I felt that most of the survey success that we had was the relationship that I had with the state surveyor, with the program manager. And when they came into the building, I was like, hey, we're not going to be perfect, right?
Sure.
But we're going to try our absolute best to do whatever we can. We'll be respectful of like the things that you say and do. And I think that help the survey process. But how much communication is Avere giving to their administrators and DONs just to kind of on both sides to help that survey process? So
one of my favorite things, I won't say best, about Avere forming is we were able to acquire a director of regulatory compliance, Steve Schatz. He is a former surveyor, program manager, regional, and he retired from the state. And so he says he's having fun, which I love that. But he tracks our surveys. He talks to Health and Human Services if we need to, but he does on-sites with the buildings, and then he does education as well as I do. We do survey tips of the week, but we'll tell them where our trends are, what tags we're seeing. If we're having communication with the state, we give that to the administrators, right? But I mean, to your point, like it's pretty cool to have like this whole division of just regulatory compliance. And we didn't have that in Trinity, so I'm super happy we have that in Avere.
Yeah.
And he's a character, if you don't know him, by the way.
Yes, he is. Yes, he is.
He is a character. But he has been a great addition. And so just having that education to give from a survey perspective to our administrators, like, he looks at their 2567s, he'll look at their survey documents and give insight or, hey, maybe look at it this way, even if it's from a self-report. So he's been very instrumental in that.
Good for him.
Would y'all both agree that like surveys are largely driven by the tenure of the DON and the administrator? Is that a fair statement or no? I've read that before. No,
not today.
Okay.
I think in the past, maybe.
I actually think I'd like to back it out a little bit from 50,000 feet. And this is kind of a question for all of you, but going back to culture, I would say the healthcare in general, the culture has been over the past 10 years that there was a lot of bad actors and regulation came in really, really strong, which is probably correct, the right thing to do. And then it just built on it. The more regulation, and it just kept going. And I would say just in general, it seemed as if there was a loss of the end picture, which is good patient care. And it was just like, there's this group that was created that was given this kind of empty wallet to go spend money and hire people to continue regulating when really there was no clinical benefit. There was no benefit whatsoever in continuing to upregulate. We saw this. We've been with CLIA, right? So laboratories have a accrediting body called CLIA since I think the 1970s. And last year we luckily got out of, because of an administrative change at the presidential level, we got out of the FDA was going to come in. Food and Drug Administration was going to also regulate labs, which is like, that doesn't make a lot of sense that Food and Drug Administration would regulate labs, but they were going to do that just for the sake of having additional regulations on laboratories. And I see that just this cultural shift happening in the last 12 months as to like, well, hold on a second. Now you can be unapologetically for profit, right? Like I feel, and I like that. I think that it's like, we should be, this is a capitalistic society. We should be here and let us go out and do a great job, but don't just regulate to regulate. I mean, and that's part of it for me is like, we need people to regulate. And I like that you're doing it internally. And there needs to be some safekeeping there. But I think the country in general is moving towards, and I should say healthcare in general is moving towards a more balanced approach. And I'm curious what all of you think on that.
So I would tell you if we want to go back to acute versus, long-term care, being regulated by Joint Commission comparatively to CMS and Health and Human Services is wildly different. My first Joint Commission survey, we knew who the surveyors were. We knew they were coming. We knew how many charts they were going to look at. We chose what charts they were going to look at. I mean, you're paying them to come in and do this survey, right? Yeah. But they also came into the room and they're like, tell us what your problems are. And I was like, we're going to tell them what our problems are. Like, it was just a little strange, right?
It's a partnership, though.
Yeah, but it is a partnership. And I think, I do hope that that's where we're going, is that we all want the best for healthcare. We all want the best for our elderly. I hope that that's where we're going, is because here's the thing, we're going to make mistakes. We're not perfect. We depend on our employees to do the right thing. Yep. We can't be there and make sure every employee does the best, but we can provide them with the tools. We can provide them with the resources. We can give them education, but people are going to make mistakes, So I like that, we're hopefully going more towards that conversation of how do we be better? But I do think that kind of going back to COVID and why regulation has changed. I mean, COVID has created so much burnout in healthcare, right? In all settings. Okay. I mean, you look at like our healthcare administrator forums, like what do you see? People are burnt out, right, Kip? You see it. They're like, I don't want to do this anymore. I'm tired. I feel beat up. I feel attacked. And that's what we're battling in this industry, is how do we keep people wanting to do this every day?
Yeah. So we had an administrator on not too long ago, and he was, besides him, everybody I talked to, Kip, you slept with your phone on your pillow. Like, how do you even sort of try to help with burnout at the leadership level inside the building? It's hard to turn it off. I would imagine for anybody who does that, like it's going to be generally hard, but it's also creating problems.
Yeah. I mean, I think that what I've learned over my course of my career is be proactive and not reactive. I think a lot of what happens is you're tired, you leave early when you should have stayed and talked to that CNA. Yeah. Right. And then you go home and something's happened and now you're on the phone all night.
And then you're back in the building.
Yeah. Where I could have just done what I thought I should do. Right. So just being proactive, I think, is a big part of this in general. But again, I think too, what I've learned the hard way is I can't do it all. Yeah. And I have to have people and trust people to do their jobs. And I mean, that's a big part of Avere right now, right? Yep. And I think that's the big thing, is that it's the same thing with being an administrator, right, Kip? Like, you have a team of people, you have a lead CNA sometimes or whoever, and you're trusting them to lead the team when you do leave for the night or when you go home. So again, creating them with that education, resources, having those conversations. But yeah, I mean, I'm hopeful that healthcare is still going in a positive direction. I think we all are.
I think it's in a more positive direction now.
Yeah.
I think that's what I asked Travis. I was like, how close are we? Because I know from COVID, we were like, we're exhausted. Like, we just got run over like time and time again. We thought it was going to get better. And then 2023 comes around and it's still like 3 years and still not better. 24 comes around and it's just kind of the same almost. And so I asked Travis, like, how close are we? Like, how much hope can we give to those administrators and specifically those DONs? Because that DON job is hard.
It is.
And I didn't realize how actually difficult it was until I mature in my relationship and in my career and see how difficult it is. But it's like, how close are we? How much like hope can we give them? Because we're losing some really good people. And I think he said, he referred, he's like, I think we're really, really close. So hopefully with the survey process and just good people acquiring new homes, I think just that collaborative effort and just the preaching of the unity from the top down, the bottom up, I think hopefully that transcends long-term care and skilled nursing.
I hope so. And to your point, thank you to all of our nurses and administrators and CNAs and housekeepers, dietary, I could go on. But I mean, without them, we don't have great outcomes. So thanks to all those people.
That was, as an administrator, that was one part that I really tried to focus on was like, hey, other people can take care of the residents, but the people who can't take care of the staff members, like that's my responsibility. And so I felt like any administrator, any DON listening, like I would highly encourage you. focus on your staff, like
Sure.
take care of your staff, like, because if you can prevent them from burning out, like I think your facility just becomes better overall, and have those fun moments, have those where you're videoing and you're doing competitions, and on Fridays you're cooking out, like just do different fun stuff. And I think that just makes a facility just so much greater.
Yeah.
It's all about that culture.
Exactly what
one of the things that we kind of like when we decided to start this podcast, we wanted to kind of like shine a positive light. So we talk about some things that are, things we need to work on or things the industry is moving forward. But really there's like a tremendous amount of amazing work that happens in long-term care. And so I would just say, like, what are you most excited about, or what like gets you so excited that you want to keep doing this and grow and keep on going? I mean, I think the industry as a whole, everybody that I come across, the hearts on these folks of like to really care for elderly folks is incredible. It's amazing. And I think it's a really hard job. And so, but the idea here is like, we wanted to shine a positive light. I guess, what are you most excited about from like the industry standpoint?
I'm excited about our growth. I'm excited about other companies' growth too. I mean, it's not just Avere buying, there's other companies buying. I'm excited for money to be put back into Texas and into healthcare, and all of that I think is super exciting. And I think to your point, it shows that we are changing, and healthcare is reforming.
Yeah.
The rates are such a great thing for us. Yep. Surveys have been, I won't say, we'll say better. I think we're all still struggling some, but I'm excited about that. I'm excited about our growth, and I'm excited about building the people for tomorrow. I think I'm a parent. I think most of us have kids, right? Like, I think it's that too. I mean, my daughter goes to the nursing homes with me, and my son goes, and, like seeing them give back, because I think that's what scares me more than anything. I'm sure it does y'all too, but just building like our next generation of who's going to take care of us when we get old.
Yeah.
I have one question I've been wanting to ask for a while.
Oh gosh.
So, and you just alluded to it, like you're a mom, you're a professional working woman. Like, how are you dealing with the stress? How has that impacted your family? And like, what kind of just encouragement can you give to the ladies out there who are working so hard to provide for their family? What can you say to them?
I mean, I love it. Let's go estrogen. Let's go on and power. I think I could not do this without my husband, by the way. So I have to shout out my husband, Nick, because, he knows that I like have this drive inside of me that he's like, when is enough? When is it going to be this? And I'm like, I don't know when it's enough. But yeah, I couldn't do this without him. I think support is a big part of it. But it's also my team, like my chief nursing officer, like if there's something I need to go to, or if my divisional, my regional, I think we all need to have lives outside of this to the best of our abilities. So, it's our team, like helping each other be able to do it. But I couldn't do this without my husband. So we're going to say thank you, Nick, again, because he needs to know that I said thank you to that.
I think that's super important. You have to, the support that you have from the top down. I think that's always important.
Funny enough, I had a vendor, not principal, no offense, that kept sending me like this bottles of whiskey. And I was like, I'm not even like a big whiskey drinker. And they were like, that's for your husband. And I was like, oh, smart. Yeah.
Smart play.
He was like, I knew they were my favorite. I was like, man. I was like, yeah, that's probably right. He probably does need that for when I'm, traveling and not home.
Very good.
Chris will send you bottles of Fernet.
Yeah. No one likes that. We didn't actually have any Fernet, did we? Last time.
We didn't. We'll have some tonight. Oh, we tried.
Tomorrow.
We drank Fernet with y'all.
We did.
We did.
Yeah.
Okay, we did.
We did.
The world's greatest.
What an epic dinner we had.
Yes, we did. Yes, we did. That was a lot of belly laughs.
A lot of laughs.
By the way, if Chris looks at his paper one more time to ask you questions, this is a blank page. It says Avere.
It's giving him inspiration to draw from.
It reminds me of like that legend. Did you see
And on that note,
Will Smith legend movie where he's got like the empty Bible?
It's giving him inspiration. It's like he's feeding from a blank piece of paper.
It's a fidget spinner, James.
I love that.
Ashley, it has been an absolute pleasure and honor to sit down and talk with you.
Thank you for doing this.
Yeah,
Yeah.
it's super fun. I always ask before everyone leaves. The title of our podcast is Our Purpose.
Yeah.
Close with what's your purpose? Close with the light that you shine with Avere.
Here, I wrote it down for you. You can read it.
Sure, you look at the blank piece of paper as my inspiration.
Share your purpose with us and what you're.
So I actually have like my own internal purpose that, and you're gonna judge me maybe a little bit for it, but I'm a strong and confident woman by acknowledging my own inner beauty and showing others theirs, helping them on their journey by being a lighthouse for God.
Wow.
Yeah. I saw it. Yeah. So, I mean, I think my purpose is to keep giving back and giving to our residents and providing the best that we can. And I hope to keep doing that for years to come.
Can you say it one more time so I can listen?
No, I'm not saying it again.
That was so good.
Oh, yeah.
We love it. Thank you so much for being here.
Thank y'all for having us. I'm glad I was so nervous for no reason now that I see his blank paper.
I was prepared.
That's how Chris prepares for meetings.
Noted for next time.
I told you it'd be easy.
Yeah.
From all of us at Our Purpose Podcast, thank you, Ashley, for joining us.
Yes.
Thank you for the light that you shine in long-term care.
Yeah.
Thanks for the light that you give to Avere Healthcare, and good luck on your journey.
Yeah. And eat 'em up cats.
Eat them up.
Gig 'em.
That's right. Thanks for joining us today. Thanks everyone for listening to the Our Purpose Podcast. Thank you, Ashley, for joining us as well. THCA 75th anniversary this week. It's been fun. So thanks for joining us. Thanks for listening, everybody. See you next time.
Thank you.